Arizona's first hold on, make sure I say this right, micro hospital. Phoenix ER and Medical Hospital encourages people to visit the emergency room there if they're having emergency symptoms. Chase Weston is here with me. Chase, good morning. How are you?
Good. How are you?
So I got to make sure I say micro hospital.
That's right.
Tell me what a micro hospital is.
Well, micro hospital is, if you think of one of your big facilities around the valley, into a really small little box. We basically took an old grocery store and turned it into a little hospital. It has 3 beds for our inpatient and 7 beds in our ER. Everything you could think of in a big hospital, maybe except for ICU, trauma, and surgery.
So, and you're here to talk to us about people going to the emergency room. We were talking before. Tell this little story here because this is so important.
Yeah, you know, when we first opened about a year and a half ago, we had a gentleman come in and he was just telling our staff, I've kind of had chest pains for 3 or 4 days, and I just thought I should get it checked out. He came in, about 2 minutes, he was in a bed, meeting the physician. Physician goes to shake his hand, and he falls over and has a heart attack on the doctor.
My God.
Our brilliant staff brought him back very quickly. Gentleman survived, came back the next day to thank us for our service. But we all wonder during this pandemic, if this was today, and he's just thinking I should get it checked out, would he avoid the hospital because of COVID-19?
Right.
And then if he did, he'd be in real trouble at home.
Yeah, and that's why we're saying that. I know people are kind of like, well, I want to save the bed for someone who needs it, who has COVID-19, but you need to make sure you're checking on yourself and going to the emergency room if you're having not the COVID-19 symptoms, but having, as you said right here, a heart attack symptom.
Absolutely. And some of the numbers that are coming out and some of the data that's coming out right now is saying that, hospitals across the valley are starting to fill up. And that's true, but that's not necessarily because of COVID-19. So people are starting to feel okay when they are having those emergency symptoms. Don't get scared. If you have those symptoms, please come in.
Yeah, and that's where you guys come in because, as you said, you're a micro hospital, which is so important at this time. That way they come see you and maybe not have to go so quickly to the hospital yet, and you guys take care of that.
Absolutely. We're kind of uniquely suited in our entrances. We have a red zone entrance and a green zone entrance, and we're very easy for us to put up plastic walls and have different zones to keep people physically separated if they are having respiratory symptoms versus maybe some of those other regular emergency symptoms.
How many of these are around the valley? You're the only one, aren't you?
We're the only one. We have a sister facility now in Tucson. But yes, we are Arizona's first micro hospital.
So, but you also work with the bigger hospitals too, because you said you got him over to the bigger hospital right away.
Yeah, we actually have an agreement with Chandler Regional. This gentleman was in the cath lab, I heard, with under 45 minutes. Wow. So, we had Chandler Fire there very, very quickly, and we stabilized him, and he went right over to the cath lab, and he did well. So.
All right, if I am sitting at home right now, and there are probably some right now going, I do have a little pain, but it just might go away or something, and whatever like that. But it's been going on for a couple of days. What do you suggest these people do?
Come in. We have a way to separate you from people that are having respiratory symptoms or just there to get tested for COVID-19. Don't wait. We don't want anything bad to happen to you.
Yeah, that's great. So to remind people where your micro hospital is.
Yep, we're at the southwest corner of Queen Creek and Dobson in Chandler, near downtown Ocotillo.
So, and Chase, again, you're speaking and saying for everybody in the medical field, go get taken care of. I know we saw a rise a little bit in the last couple of days of beds being, and the health doctor said this recently, to open up things. So you're ready to go.
I'm ready to go. We're open for patients. We're open for testing, and we're going to keep you and our employees safe. I think that's important to know. We've tested every one of our employees, and everybody's been negative. So our separation works.
That's awesome, Chase. Thank you very much.
Thanks for having me.
There you go. All right, we have information on aztv.com.